These are the therabands, or the bands which we use to do exercises for the shoulder joint. The therabands are advised to strengthen the rotator cuff muscles of the shoulder joint. It is a particular routine which you have to follow to progressively strengthen the shoulder muscles. The bands are of different colors. The weakest color is the yellow, the next stronger one is the red, then the green, the blue, black, silver and gold. The silver and gold are for athletic training and towards the end. So when you do a surgery for the shoulder or strengthen the rotator cuff for other reasons like a tendinitis or acromial joint arthritis or biceps tendinitis, then we start with either the yellow or the red color. The Theraband exercises are divided into 3 phases. Phase 1, where the patient has to meet the physiotherapist for at least 5 days, because the band exercises, as you will see now, are a little complicated or not as easy as a regular knee exercise or a hip exercise. So the patient has to meet the physiotherapist daily for 4 or 5 or 6 days. The purpose of this video is to learn the exercise at home when you have a lot of confusions as to how to do and the angles and stuff like that. So you can use this video on the YouTube, but still the phase 1 where you meet the physiotherapist daily is very important. In phase 2, the same exercises the physiotherapist would have told you the particular type of band you have to use. Either the red one, or if the muscles are still weaker, you start with the yellow band, like after surgeries. So the band which has been selected by the physiotherapist to start with should be used at home, where you do the phase 2 exercises, the same set of exercises done at home. And the progression between the bands, that is from red to green or green to blue, is to be done in a period of 3 to 4 weeks time. The phase 3 is when the same set of exercises are done with the blue, black and silver. So the phase 1 where you do it with the physiotherapist under observation, you don't do it at home, only once when you do the exercise with the physiotherapist in the hospital. Do it for 3 or 4 or 5 days, and then phase 2, the exercises where you do the yellow, red and green bands, and phase 3 where you progress to the higher strength bands when you are doing a strengthening with the blue, black and the silver bands. The bands are quite simple to carry. They are just sheets which can be rolled and kept in the pocket, and you can travel anywhere. So there is no fancy equipment, no weights. It's quite easy to carry around, so there is no excuse of not doing the exercise when you are traveling for a busy person. So let us see how the band exercises are done. So first is to know how to tie the band on the hand, because you can tie it this way or that way. So just holding that, it can get loose or it can hurt your finger there. So there are moments where you pull the hand toward this side, that is internal rotation. So in those movements it is better to tie the band like that, starting from outside and taking one round and holding like that, so that the pressure is on the hypothenar eminence or the ulnar side of the hand. You can pull like that, which will not hurt your hand. For movements where you do outward rotation or external rotation, you can start with the band inside and rotate them outwards and then pull outwards like that. So there won't be pressure on this side where people say it hurts when you pull. So that is how you do it. For mobilizing the scapula, that is a shoulder blade on the back of the shoulder. So first one is scapular elevation. You keep the band under the feet. This can be done either sitting on a chair or standing up, and you elevate the scapula or elevate the shoulder with the bands. Your elbow does not bend. You pull it up and go down. You pull it up and go down. The body does not move, only the shoulder moves up and down, up and down. You hold it and put it down. So 10 repetitions of this. For the next set of exercises, we need to tie the band at two levels. That is level 1 where it is somewhere around the eye level, or level 2 where it is somewhere around the hip level. It need not be a post like this. It can be the knob of a door, or the hook of a door above, or you can use a window. When you have bars parallelly on the window, you can select a bar at your hip level and at your eye level, and the band is tied onto that bar for doing the exercise in various directions. The next exercise is scapular retraction. That is, the shoulder blade is pulled back and brought forwards, pulled back and brought forwards. For that, you use the level 1 place to bind the Theraband and pull your hand backwards, so that your shoulder has to move to the back when you do that, and then go forwards. Again, pull back so that your shoulder blade moves, and then go forwards. 10 repetitions of the same. The next one is scapular protraction, that is movement towards the front. You make a small noose and tie it on the level 1 area. You hold your hand with your elbow flexed and tie the band at your wrist, and then straighten your elbow. And now the movement is just the movement of the shoulder forwards and backwards. Forwards and backwards, yes. The elbow does not move and your hand stays parallel to the floor. So the next exercise is shoulder flexion, where you tie at level 2 at your hip level, and then forward flex the hand. You can go up to 95 degrees, slightly above the 90-degree mark, and then go down to your body level. Again, go up and down. The next exercise is shoulder abduction. You stand with your side towards the level 2 where you have tied the band, and abduct the hand outwards about 45 degrees, and then bring it back to the midline. Then again outwards and towards the midline. Next is shoulder adduction, adduction, that is movement towards the body. So the band tied at level 2 and pull towards your body to touch your body, and then go back. Pull towards your body and then go back. You need not cross the body, you can go up to your body and then go back. The next one is chest pulls. So you tie the band on both the hands. You don't need the tie on doorknob. You lift the hand up 90 degrees parallel to the floor and then pull outwards. All the way out, and then towards the midline, then outwards again, all the way out with your hand parallel to the floor. Good. The next is scapular pull downs, where you tie at level 1 and pull the hands with the elbow flexed at 90 degrees backwards, and then go back and backwards. You should feel your scapula move when you do that. Let the shoulder blade move on the back of your chest. Shoulder external rotation. You tie the band at level 2, standing with your opposite side towards the tying area. The hand flex at 90 degrees at the elbow and rotate outwards and in. You are rotating the shoulder outwards. Your elbow should not move away from the body. Your elbow should move near your body. This is shoulder internal rotation, where you tie at level 2 the side you are exercising near the tying area, elbow flexed at 90 and internally rotate. You rotate your hand inwards and then go back to 90. Inwards and go back to 90. The elbow should not move from the place it is. Only the shoulder rotates. Shoulder extension, where you tie it level 2 at the level of your hip, facing the tying area, the hands, yes, the band rolled over the hand and pull backwards to the level of your body and then go back. And go back. The next is shoulder horizontal abduction. You tie at level 1, with your side facing the wall and pull outwards. The hand stays at 90 degrees and then go back and out. You don't bend your elbow. The hand moves towards the center and then outwards. Yes. It's just a movement in the horizontal plane. Horizontal adduction. That is, you move the shoulder inwards. Elbow doesn't bend. You hold the hand parallel to the floor and rotate it inwards. And back to neutral and inwards. That is horizontal adduction. Diagonal extension, where you tie at level 1 at your eye level and pull downwards and cross your body. Again go back, cross your body. The elbow does not bend. Keep the elbow straight. The second diagonal extension, you again tie at level 1. You start from there, you keep the band a little shorter and then pull it across your body and back, all the way up. The elbow remains straight, pull it across your body and back. Forward thrust, where you tie at level 1, you stand with your back towards the wall and bend your hand with a band quite short so that your hand is behind your back, tie it around your wrist and push forwards, give a thrust and back. Good. Elbow flexion, where you can use a seat, pass the theraband under your feet, both of them, and bend your elbow upwards. The last one is elbow extension. Sitting on a chair with an armrest, you can pass the band under the armrest and keeping your elbow flexed at 90. The second level is to pull upwards until your elbows are completely straight and above your head, and bring it back with your elbow flexed and then go up and down.